So you're heading to your plastic surgeon for a breast augmentation consultation, and you're considering which implant size you should choose. Should you go with a bigger implant or a smaller implant? Are bigger implants better? Do smaller implants have less long-term complications? What trends are we seeing in plastic surgery? We will discuss these points and more in this video. Hi, I'm Ramon Garza. I'm a board-certified plastic surgeon who specializes in complex breast reconstruction and aesthetic surgery of the breast and body. I make educational videos related to plastic surgery. When you go to your plastic surgeon for your breast augmentation consultation, you will be faced with a decision regarding which implant size to choose. Here are some important things to consider. Bigger isn't always better. A larger implant puts more strain on your soft tissues. Your soft tissues are not designed to support a large, heavy implant. Unlike your own breast tissue, which is attached to everything, the only thing supporting an implant is your skin and soft tissues. And a large, heavy implant over time can put more strain on your soft tissues and potentially cause complications in the long term. This means that the implant can become malpositioned or migrate out of the pocket that was created initially. So in this case, a smaller implant would be better in the long term. Having said that, some patients prefer a larger implant look. So when you meet with your plastic surgeon, make sure they choose a larger implant that is not going to be too much strain for your soft tissues. Next consideration, the large implant look is largely out of style. This look was made popular in the 1990s by shows like Baywatch. Since then, this look has largely gone out of style. More patients are wanting a more natural appearance with a more subtle change to their breast size. The more natural appearance is achievable with a smaller implant. Having said that, I still have some patients that want that augmented look, and for those patients, we will choose a larger implant. One question I ask patients is, when you walk into a room, do you want people to notice you've had a breast augmentation, or do you want to have a less obvious result that looks more natural? Something to think about. And lastly, an important but often overlooked consideration is how implants will affect any future surgeries. And what I mean by that is, if in the future you would ever like to have your implants removed, it may be more challenging to get a good aesthetic outcome if you've had a larger breast augmentation. For example, if a patient has a smaller implant and the implant is then removed, the soft tissues oftentimes will recover easier than someone who has had a larger implant where the soft tissues have stretched to a degree, and now the revision surgery becomes more complex. We have to do things like a breast lift or fat grafting to get a good or reasonable aesthetic outcome. So if you in the future would consider having your implants removed, it may be better to go with a smaller implant because any revision surgery will be much easier for the plastic surgeon in the future. So before you meet with your plastic surgeon, really consider implant size. If a smaller implant will achieve the goals you're looking for, I tend to recommend going smaller if possible. If you like this content, make sure to subscribe to our channel. And if you have questions regarding breast augmentation or implant choice, call our office to schedule an appointment. We'd be happy to see you.